Hi, I'm Christy Tenorowitz. I am a trauma analyst at Eastern Idaho Regional Medical Center. I work in trauma services and injury prevention, and today we're going to talk about elderly fall prevention. Every year, thousands of elderly people age 65 and older experience a fall. The CDC estimates that 1 in 3 elderly people will have a fall every year. 1 in 5 of those falls will result in a serious injury or even death. There are several reasons that the elderly may fall. They may have difficulty with balance, they may have weakness, or they may have chronic pain, which causes them difficulty in getting around. They may have visual problems or hearing problems that make them prone to falling. They may also be on medications, which can cause dizziness or may make them more prone to bleed should they fall. And last of all, there may be tripping hazards around their home that are causing them to fall. Fortunately, there are many things that can be done to decrease one's fall risk. Many communities offer strength and flexibility exercise programs which the elderly can participate in. Annual hearing and visual exams and keeping eyeglasses up to date and hearing aids handy can also help prevent falls. It would also be helpful to review medications with the physician and determine which medications might cause dizziness or increase a bleeding risk should a fall occur. It's essential to assess the home for safety and identify any fall risks which may be present. There are several things that you can do to make a home safer. Removing unnecessary throw rugs or using double-sided tape so that they don't slip. Making sure that hand railings are secure on all steps and stairs, and even considering putting hand railings on both sides of the stairs. Installing grab bars near the toilet, on walls, near the bath or shower, and applying non-slip strips in the bath and shower. Also, consider using assisted devices such as a toilet seat which is raised or a non-slip shower chair. It's also important to have adequate lighting in hallways, bathrooms, and stairs with easily accessible light switches and night lights. Also be sure all cords are tucked away, such as lamp cords, extension cords, and phone cords. It's also important to wear non-slip slippers or shoes with a sturdy sole. Don't forget to consider the risk that pets may cause for falling. Be sure and keep pet toys and dishes and bowls out of walking areas. Consider a collar with the bell to always know where the pet is. And consider obedience training to control jumping or pulling behaviors that may cause a fall. Also consider the use of a medical alert device that can be worn around the neck or wrist to summon help in the event of a fall. Although not all falls are preventable, many can be avoided if we assess the home and make necessary changes so that our elderly loved ones can continue to live a safe, active, and healthy lifestyle.